What if I told you that your pelvic pain isn't just one thing? It could be caused by any of these three very different conditions requiring a unique approach. I'm going to teach you how your specialist tells them apart and how we find the real source of your pain. Hello, I'm Mr. Saurabh Phadnis. I'm a consultant gynecologist and gynecological oncologist working in London, and I specialize in various gynecological conditions ranging from pelvic pain, heavy menstrual bleeding, and gynecological cancers. One of the most challenging condition and emotionally draining issues that my patients face is chronic pelvic pain. It is a debilitating symptom but not a diagnosis. The pain is a signal, and it is my job to uncover what is causing it. So often women come to me confused, having been told that they may have endometriosis, ovarian cysts, or fibroids without a clear answer. These three conditions are primary culprits behind chronic pelvic pain, but they are fundamentally different. In this video, I will explain to you the key differences between these three conditions, how they feel, and how we use advanced surgical technique like laparoscopy to diagnose and treat these conditions effectively in a targeted manner. Are you struggling with pelvic pain? Here's why it's so hard to get a diagnosis. Chronic pelvic pain is one of the greatest mysteries for most women. Why? Because the pelvis is a crowded neighborhood. You have your uterus, ovaries, cervix, bowel, bladder, all in that space. And a problem with any of these organs can cause symptom of pelvic pain. Furthermore, the symptoms of three common gynecological conditions that cause pelvic pain overlap significantly, such as endometriosis, ovarian cysts, and fibroids. You can experience heavy menstrual bleeding, painful bleeding, and pressure symptoms with all the three conditions. And therefore, just describing your pelvic pain isn't enough. We need to dig deeper and do targeted investigations to arrive to a diagnosis. And that's where a specialist comes in. Is your period pain truly next level? Could be a common condition. Our first suspect is endometriosis. It's a chronic inflammatory condition. It's a condition where the lining of the uterus that is usually present inside the uterus is implanted elsewhere outside the uterus in the pelvic region. Whenever you have a period, there is bleeding from this lining which is outside the uterus. That causes an inflammatory reaction and causes severe pain. Often the commonest symptom of endometriosis is cyclical severe pain, and this may not be relieved with simple painkillers, and often you may miss work or school. Often the pain can be sharp pulling pain, and sometimes it may affect your bladder and bowel function. Because of the inflammation on the surface of the bladder or the bowel, you may have symptoms like going to the loo frequently to pass urine, or pain while passing urine. In severe cases, you can even pass blood whilst you're passing urine. Also, similarly, you can have change in bowel habits, and often a symptom of endometriosis is cyclical bleeding via the back passage during your periods. These are signs of our first culprit, endometriosis. Not all pelvic pain is your periods. Sometimes it's this. Now let's talk about ovarian cysts. Most ovarian cysts are functional cysts which come and go as part of your menstrual cycle. If I scan 10 women, 9 of them will have a cyst on the ovary at some point in their menstrual cycle. This is normal. This is part of your menstrual cycle. But we worry about a cyst that either keeps growing, becomes large, that can cause pain. Often it's the dull pain, and depending on the size of the cyst, you may have bloating in the tummy or your tummy becomes bigger. Sometimes the cyst may have bleeding inside it. That's called a hemorrhagic cyst. Hemorrhagic cysts can be very painful, and often it will take few weeks for that pain to resolve. Usually, surgery is not required for a hemorrhagic cyst. Usually, we suggest regular painkillers to alleviate the pain. When a cyst ruptures, the pain is often very sudden, sharp, and severe. May last for a few minutes. It may require stronger painkillers, or even sometimes you may feel that simple painkillers are not working and may need hospital admission because it makes the ovary heavy, can twist or thwart the blood supply to the ovary. This is a serious emergency called ovarian torsion. Ovarian torsion is an emergency because it presents with sudden onset, severe pain in the belly. Simple painkillers may not work for this condition. Often, you may need surgery to untwist the ovary. If the ovarian torsion is prolonged and lasts for a number of days, then often blood supply to the ovary is affected and the ovary may not be viable. Therefore, we need to act quickly. Feeling a heavy, dragging pressure in your pelvis? This might be why. Our final suspect is uterine fibroids. These are non-cancerous growths from the muscular part of the uterus and can cause a heaviness or feeling dragging pressure in the pelvis. This pain is different from endometriosis or having a ovarian cyst. Often, depending on the size of the fibroid, it may cause pressure on the bladder or bowel. And if it's causing pressure on the bladder, it causes increased frequency of passing urine. Sometimes pressure on the bowel may cause constipation. While you can get period-like cramping, day-to-day pressure is due to the sheer size of the fibroids and the weight of the fibroids. So, if your pain is less sharp and dull ache and heavy pressure, fibroids might be the culprit. How do we get a 100% certain diagnosis for pelvic pain? We can look inside. When I see a patient with chronic pelvic pain after a detailed history and often investigation like ultrasound scan, finally laparoscopy may be necessary to find out the exact cause of pelvic pain. Laparoscopy is a surgical procedure. It is a gold standard investigation for pelvic pain. When I do a laparoscopy, I introduce a very powerful camera through the belly button, and that gives me a crystal clear picture of what's happening inside the belly. I might find dark colored spots inside the pelvis, which may be endometriosis. I will be able to localize exact location of the fibroids or cyst on the ovaries. Laparoscopy is not only for diagnosis, but if we find an obvious cause for pelvic pain, we can go ahead and treat it at the same time. Treating pelvic pain isn't one size fits all. Here's how we tailor the surgery. Laparoscopy is not only for diagnosis but also for treatment. If I do a laparoscopy and find endometriosis is an inflammatory condition. We then go ahead and excise the endometriotic lesion or spot. This gives you a long interval of symptom relief. If I find an ovarian cyst, I carefully remove the cyst, thereby preserving the healthy ovary. If I find fibroids, we can remove fibroids via the keyhole approach. So laparoscopy not only helps us with diagnosis, but to tailor the situation and tailor the treatment towards the condition such that we can not only diagnose the condition causing pelvic pain, but also treat it at the same time. The beauty of this approach is that we can often address all these issues with one minimally invasive operation, providing comprehensive solution to your pain and finally giving you the relief that you deserve.